Welcome to the all viewers and well wishers of the world. The purpose of my lecture is learn the knowledge from the world, return the knowledge to the world. Motto of my life is learn, earn, and return. I have learned a lot, earned a lot. Now the time to return a lot to the world from where I have got the knowledge. Topic of today is very important, gout. It is because of the high uric acid level in the blood, and it is very common nowadays in this part of the world because people are taking a lot of fast food and lot of protein, and they do suffer lot of problem because of the uric acid. So the introduction to the gout, it is the king of diseases and disease of the king because it is very painful. And why it is said to be the king of diseases, it is because of its pain and severity. And the kings take lot of meat and alcohol. And 5th century BC, Hippocrates called it as unwalkable disease because it is so painful that a person is not able to walk. Very painful disease of joints of the humans only due to the excessive uric acid in the blood. It is called hyperuricemia. Needle-like crystals of the uric acid deposit in the joints, capillaries, and the skin, causing very severe and excruciating pain. Usually occurs when serum uric acid level is more than 7 milligram percent in males and 5 milligram percent in females. Gout, as one can see, the person is having so much pain that feeling like some pricks are just attached to the foot of the person, and here you can just see the both feet very red and hot. And here disease of the kings, they do like woman and wine and lot of meat, as one can see. These are just the swollen foot of the king. He is unable to move and just taking lot of alcohol. Now, gout in French means taste. It have got nothing with the hand or foot. Latin word for the gout is podagra. It begins at night. Big toe is painful, red and swollen, so painful that the patient do not allow even touch of the cloth or the bed sheet to the affected part, and patient is so scared that if anyone pass just from near to him, he is so scared and feels pain that if the one is going to touch him. The disease is hereditary, run in families, more in males than females. That is, ratio is 20:1. The reason is the male is more muscular and male uses more protein and more suffer the gout. Mostly in men, age 40 years and above, rare in the younger woman, but occur after the menopause in the woman, and mostly involve big toe, less commonly other sites like wrist, fingers, and elbow. Acute attack can occur without warning after using a lot of alcohol or the meat or after injury or after the surgery. Here, the foods which are responsible for the gout, as one can see, the meat that is of different color, white meat, red meat, dark meat, and also the pulses of every kind. These are the vegetable proteins, so these are the animal protein. So any kind of protein that has been used and eaten in excess to the normal, these are responsible for gout. Now, in gout, the initial attack is monoarticular and mostly involve first metatarsophalangeal joint. Other joints are midfoot, ankles, heels, and knees. In chronic cases, tophi are developed. These are painless, seen in helix of the ear over olecranon processes, Achilles tendon, toe, or the finger joints. These are basically the uric acid crystals collection in the form of tophi. A foreign body reaction, MHQ crystals surrounded by the fibrous tissue. These crystals are formed in gout and these are just surrounded by the fibrous tissue. Renal disease like urolithiasis, urate nephropathy, uric nephropathy is also seen in this disease. So here one can see the gout, uric acid crystals are deposited here as one can see, and here uric acid built up and inflamed joint because of the uric acid crystals. These are the sharp needle-like uric acid crystal which hurt and cause inflammation. So here in case of the tophi, these are the swollen and inflamed joint, and here there is the deposition of the uric acid crystal and uric acid accumulation is here and that is forming the tophi. So the tophi bumps can be seen anywhere else in the fingers and other part of the body, but mostly they are on the foot and on hand. Now the types of the gouts, these are 4 types of the gout. Number 1, asymptomatic, no pain, just on checking the uric acid one can have the high uric acid level and no symptom. Acute, very painful condition. Chronic can lead to the tophi, and intercritical, that is in between the acute and chronic. So these are the 4 types of the gout. Now, the risk factors which are responsible for causing the gout attack, these are alcoholism, especially the beer drinking, obesity and overeating, high protein and meat diet, severe illness or the injury, trauma, immobility that also lead to the gout. Medicines like speed, salicylate, pyrazinamide, ethambutol, ethanol, diuretics, especially the lead diuretics, these are all notorious causing the flare-up of the gout. Then family history of the gout, age and the sex is important. Men over 40 years of age and above, and female after the menopause. Smoking also responsible risk factor. The other are the psoriasis, kidney dysfunction, leukemia, lymphoma, lung cancer. There is more breakdown of the cells and leading to the purine deposit and ultimately the uric acid. Congestive heart failure, starvation, anemia, dehydration, fructose sweetened beverages and high sodium intake. These are all the risk factors responsible for that. The great Charlie Chaplin said, "My pain may be the reason for someone's laugh." When he performed, he has sometimes the pain, but he performed to make someone laugh. But my laugh must never be the reason for somebody's pain. And I don't want to hurt anyone because of my laugh. I just want that someone is going to laugh because of my talks and things and no pain to any person. The great Charlie Chaplin said. Now the clinical features are high uric acid but no symptom, quite before storm, asymptomatic, I have already told you. Then sudden severe crushing pain around affected joints, that is acute attack, first big toe, later ankles, knees, hands, wrist and elbows. Swelling of the joint, redness around the joint and low-grade fever is also seen. And here one can see the most common part of the body, the foot, this part of the foot, and this part of the foot is swollen. Patient is unable to walk and the patient come limping to the clinic, and here one can see the inflamed part, first metatarsophalangeal joint, and here again these are the most common parts which are affected. Then the other parts involved are knee and elbow and wrist and the fingers. These are all responsible. And if the uric acid is not treated, that can lead to this kind of problem and the wound, which are very dangerous looking wound. Now the types of the gout, there are three types of the gout. Number one is the primary gout, cause not known, it is idiopathic. PRPP synthetase overactivity, so the more uric acid will be synthesized, or HGPRT deficiency, that will just allow less excretion out of the uric acid, so the accumulation of the uric acid in the body. So the check these enzymes activity. Overproducer and under excretor. Very simple. If the production is more and the excretion is less, the result will be accumulation of uric acid. Secondary gout. The cause is always known. Certain medications and drugs used for the malignancy, the cytotoxic drugs, are notorious for causing gout, and these are the reason of secondary gout. Pseudo gout, symptomatic gout-like condition involving calcium deposit on the bones of the foot, not uric acid crystal. So it behaves like gout, so it is called pseudo gout. Now, we should know something about the uric acid. Uric acid is the end product of the purine metabolism. Every body's cell consists of cytoplasm and the nucleus. The nucleus contains nucleic acid, which contain purine, so made inside body, that is called endogenous protection of uric acid. Some come from outside of the body, from foods containing purines, meat, so that is called exogenous source of uric acid. Purine produce xanthine and hypoxanthine, which are converted to the uric acid by the enzyme xanthine oxidase. And this xanthine oxidase, which lives inside cells as xanthine dehydrogenase and xanthine oxireductase, responsible for changing the purine to produce xanthine and hypoxanthine and ultimately to the uric acid. These enzymes are blocked as part of the treatment, so these are called xanthine oxidase inhibitor, which are being used to treat the gout so that production will be stopped. So here one can see the GMP, guanosine and guanine, and that ultimately changes to the uric acid, and AMP, adenosine, and under the action of the enzyme and adenosine deaminase, inosine, and then it changes to the hypoxanthine, and hypoxanthine under the influence of xanthine oxidase changes to the xanthine, and this xanthine under the influence of the xanthine oxidase changes to the uric acid. So as a part of the treatment, this enzyme is blocked so that it is not going to make the more uric acid. In humans and higher primates, uric acid is the final breakdown product of the purine metabolism. It is excreted in urine, or in mammals, enzyme uricase convert this uric acid to the allantoin, which is recycled and being used in the body again. Normal level of the uric acid in the blood of the male is 7 mg/cent and 5 mg/cent in case of the female. Anything above of these is said to be hyperuricemia. 70% of the daily uric acid is excreted via the kidneys. Impaired kidney excretion leads to the hyperuricemia and accumulation of the hyperuric acid in the blood. This occurs via mutation in the genes which are responsible for this in kidney and does not allow the more excretion. So, metabolism of the purine, uric acid synthesis, how the purines and uric acid is produced. Number one is the de novo pathway. Body makes new purines from the products of the protein and the carbohydrate metabolism to make the nucleic acid of the new cells of the body. So that is called de novo pathway. The other is salvage pathway. Many cells after degradation like red cells aging, muscle work, wound healing, release adenine, guanine and hyperxanthine when their life is just finished. So they produce these compounds. These are ultimately reconverted to purines which produce uric acid. So that is called salvage pathway. And here one can see the uric acid metabolism, that is the urate pool. Dietary purine intake, then tissue nucleic acid, as I have told you, de novo pathway, endogenous purine synthesis, salvage pathway. These all contribute to the urate pool. And this urate is excreted via the gut and via the renal. But if that is not excreted well, or if there is overproduction of this by these mechanisms, and there is under excretion by these mechanisms, so the result will be hyperuricemia. It may be first asymptomatic, or it is usually acute gout attack or chronic tophaceous gout, and that sometimes lead to the renal manifestation as renal lithiasis. So urate pool, because of the overproduction and under excretion by the gut and the renal, lead to the uricemia, which is responsible for causing the attack. Now, uric acid is made primarily in liver. Animals convert uric acid to water-soluble allantoin via an enzyme called urate oxidase or uricase. Allantoin is recycled and there is no uric acid accumulation in the body. And animals do have lot of this enzyme as compared to the humans, and all the carnivores which use the meat as their food, they have lot of this enzyme and they have never suffered the gout attack. Uric acid enzyme in man is controlled by a gene. If this gene is absent or defective, there is disturbed uricase enzyme production. So that's why not all the people suffer from the gout even after taking lot of proteins, because they have sufficient uricase enzyme to combat that excess uric acid form due to the purine intake, and they do not have the hyperuricemia. Now, here one can see the ingested nucleic acid, tissue destruction, breakdown to the purine, and that in the liver is going to form adenosine and guanine, and there from the liver it goes via the plasma as the uric acid, and uric acid excreted in the kidney or the gut or in the urine, or uric acid plus bacterial enzyme that just detoxicate the uric acid in the gut. Now, pathological causes of the uricemia, hyperuricemia, is increased synthesis by the de novo pathway. Primary hyperuricemia, I have told you already, enzymes PRPP synthase overactivity, so more uric acid is produced, and HGPRT PRTase deficiency, so less conversion to the allantoin and excretion through the kidney. Number 2 is increased synthesis by salvage pathway in rapidly growing tumors like leukemias, lymphomas, polycythemia rubra, infection, trauma, starvation, or stringent dieting, cytotoxic drugs, psoriasis. These all are responsible for producing more uric acid. Now the third is the diet rich in purines, meat and pulses. Fasting or rapid weight loss can temporarily elevate uric acid levels. Then decrease excretion in the renal failure, diuretic therapy, primary hyperuricemia, and acidosis. These are all responsible for hyperuricemia, that is because of overproduction or under excretion or the combination of both leading to the gout. Now, pathological causes of the hyperuricemia, that is just briefly de novo pathway, salvage pathway, diet, and the renal failure.